Welcome to another episode. We still need to figure out, this is outside of you, but we need to figure out the official name for this. I think by this point we already have. But my name is Dr. Nelson Mayamba. I welcome you back to the podcast. I have with me, not Dr. Michael, but a guest. I'm not going to do no introductions. I'm going to allow her to gracefully introduce herself. Who are you?
Thank you. And hello to our viewers out there. My name is Aone. I'm a clinical psychologist. And no, I don't read minds.
That's going to be my
Though
first
I do
question.
try to. But yeah, I'm a clinical psychologist. So I do work with the mind a lot. In fact, all the time, not just a lot. And so hit me with any question and I'll try and read your mind and answer it.
Right. See, the thing is, now I don't even know if you were joking about that or you were being serious about the mind reading thing. Let's just clarify. Can you read minds?
Let's find out.
Jeez. I don't like these people. She's playing mind games. Pun
And I'm
intended.
sitting here, and really, I'm profiling you as you speak. So I hope that doesn't make you uncomfortable, but I do hope it does a little bit. No, I'm kidding. Relax. I don't read minds.
Okay.
I don't read minds.
Okay. How long have you been doing this for?
Sure. Quite a while now, hey? So just a little bit, actually. I think I was actually confused in college, and please don't profile me,
Don't know how to.
Yeah, but I wasn't really sure what I wanted to do. So I did medicine. I started off with medicine. I did
Really?
psychology, and then I minored in business. And then I actually wanted to be a brain surgeon. And then I found out how long it took in school, and I decided, And then I really focused on psychology. So I started. It's been a while. It's been over 10 years. Yeah. So, yeah, probably even more than that. But yeah. So.
Okay. So the brain surgery or brain surgeon part, long duration. But I'm curious, what makes you hone in on psychology? Like, what makes you decide to pursue this until the end?
So I think the human body is really quite interesting. And you're a doctor, So you deal with the human body from a physical,
Right.
I'll come in, I have a sore on my hand or wherever, and we deal with it. But I think what really intrigued me was the fact that there is actually a connection between the psychological aspect of the human being
Right.
and the body, So we'll talk about psychosomatic, or somebody will take it quite lightly and say, I'm so stressed, and my body feels like this. And there's actually a physiological explanation as to why the body feels like that.
True.
In terms of, the hormones or the chemicals that the body excretes. And you know a lot more than I would, in terms of the cortisols and. So that connection in itself, because you don't see it and because it's so abstract, that makes it so intriguing, because the doctor can actually do all the tests in the world, do all the blood tests, and never really get to a point where they find what is wrong,
I think, and that's what's interesting for me. Again, I get asked this about med school, if it was hard and stuff. And I mean, personally for me, it might have been one of the easiest moments of my life. Reason being, it makes sense. Like, as long as I probably need to check. It makes sense in the sense, like, because I grew up, like, solving puzzles and playing chess and sequences, right? So if something happens, you just kind of have to work your way back. And, like, there's always a trail. But you can see, because I spoke about this with Dr. Michael, to say, like, if someone has a broken bone or it's a dislocated elbow, you'd be like, that doesn't look right, go get it checked, right? But, like, you're dealing with something you can't see. I've tried my best to, like, educate myself about stress, because you see it a lot. Someone comes in and says they're having heartburn, right? And the first question I would always ask is, okay, because again, you can see the telltale signs, they start playing with their neck, and I'm like, okay, tension, stress, headaches. What's stressing you? And more times than often, they don't think they're stressed. But like you mentioned, psychosomatic. By the way, that means something in the mind is manifesting physically, right?
So, yeah.
I try my level best to catch it, but my question is, how do you navigate something you can't see?
Yeah. The funny thing is, you don't necessarily see it, but you feel it. And that's just the interesting thing about the human body.
Right.
You know what I mean? As a doctor, you will see certain things you will see, physically.
Right.
If somebody's burnt, you will see the burn wound. If something's broken, you will see it.
Yeah.
You know what I mean? However, with the human mind, you actually feel it. As you're sitting here, as I'm sitting here, I know my normal, how I feel when I'm normal.
Right.
And I definitely know or start to feel it when I'm off. And I think it's at that point where we normally would discard things, as people. Let's use the example of stress or even burnout, right?
Yeah. Let's talk about burnout.
Yeah, I'd be like, you know what, guys, I'm actually really burnt out,
Before I let you go further, is burnout a real thing? Like, is it an actual thing?
Oh, yeah. And in fact, maybe allow me to just take you back a little
Sure.
bit, because I think we use burnout and stress interchangeably,
Yeah.
and they are not. So when you look at stress from a psychological point of view, it is literally mental pressure. There's too much. And I love the question that Dr. Michael asked you earlier when he said, in the other episode, when he asked you, if someone was to look into your brain and your brain was your bedroom, what would it look like?
Threw me that question, spun me.
And you mentioned, shoes everywhere, this. Now, when we use that same analogy in terms of stress, it's actually now picture, when you watch these cartoons and all these kids are in, these cartoons are in a bedroom and they're throwing things around and they're bouncing off beds and, things, birds, animals are flying in the
Chaos.
room. It's just chaotic. That is stress. And that's what happens when we say mental pressure. All of that is happening in your brain because your brain is trying to figure out 10 million things at the same time, So that's stress. Now, burnout, on the other hand, is actually exhaustion. You're exhausted both mentally, you're exhausted both physically, you're exhausted both emotionally. You have no more fight left in you, and you're just ready to crash. You're ready to it's like switching off a light. Like, I can't do it. I'm done, And so that's the difference between burnout and stress. Now, if we go to burnout, like when you asked me, you said there are different types of burnout.
There are different types?
Oh, yeah.
I thought you just like exhausted and beat.
There are different types of burnout.
Okay.
Or maybe let me say different triggers.
Oh, okay.
And I think the one that we commonly refer to when we say I'm burnt out is usually from work, you know, because you have so much to do and and it's easy to identify, you know what I mean? But there's also burnout from especially, and I think it's so taboo when we talk about it because I think society or our culture or cultural norms don't allow us to actually say, I'm burned out from my kids. Parental burnout. And there's just those moments where you're like, sure, whose kids are these guys? Can somebody just take them and just give me a moment to just recalibrate?
Right.
And I think that is the most dangerous because parental burnout, we have this belief that you cannot take time out from your kids. You cannot take time out from your family. So you just keep at it and keep at it and keep at it because that's the right thing to do. And it starts to lead to maladaptive behaviors,
What does that mean?
where you start engaging in behaviors that help you cope, but in the long run, those behaviors actually become problematic. For example,
Right.
easy one. Let me have a glass of wine to just unwind. You take
Relax.
You relax, and it feels good. Tomorrow is 2 glasses. The next week
It's a
is
bottle.
actually a whole bottle. You know what I mean? Next thing we're dealing with, alcoholism, So it really is a build up, But because we never talk about it, or we shy away from talking about it, especially like I say, when we talk about parental burnout,
Right.
we let it get out of hand. But if I go to the earlier point that you made to say, how does one actually know? And I was saying with mental illness, you feel it. You feel that I'm off. I'm off. Today I'm off. I don't feel it's not me.
Right.
You know, and there are many telltale signs. It could be you're a lot more forgetful. You know, it could be you're a lot more frazzled. You know, you're jittery, you're anxious. You know, and you're just not stable, you know, for lack of a better term. And those are the telltale signs. But we tend to just ignore them and be like, you know what, it's just one of those days. I'll be okay, you know.
I have a question around just in general going to see the psychologist, because it seems almost like taboo, especially in like the African cultural setting. Before I even get to that, does someone need to be stressed and burnt out to come see you, or I can just walk in and be like, listen, I think I'm okay, but I'm not sure. Maybe let's have a conversation. Maybe they might be, because you see what you're saying about the maladaptive behavior or traumatic responses. I remember when I went to see my psychologist, right? And she was explaining things to me that I do that I thought were normal, but were like compensatory mechanisms from before. For example, you think you're a nice person, but you're overextending yourself to compensate for maybe a moment where someone wasn't nice to you. So then, because you don't know these things, again, I can imagine dealing with something I can't see, even if I was trained to do it, I think. But now imagine just your average Joe. Could I potentially walk in to see Aone and be like, listen, I think I'm okay, but I just want to check. Is that possible?
Oh, yeah. Oh, yeah. And if I take you back a little bit, we talked about you knowing you're normal.
Right.
Because you feel it. You live with yourself every day.
Right.
We live within ourselves every. Well, I hope we do. But we do. We do, right? So as soon as you feel that something seems offish, it's okay to actually say, yo, you know what? Today, I'm not really sure about how I feel or where I am. So let me check it out. And that's really the first line, or what we call a mental health check-in.
Right.
You can do it yourself.
Gotcha.
You know, you don't have to wait to. In fact, you're your own best doctor. Even not just from a mental perspective, but even just from a physical perspective, because you know your level of functioning or your normal level of functioning. And as soon as you pick that as a bit off, that is where now you say, you know what I mean? And sometimes it could just be a conversation with a friend, you know what? Lately I've just been feeling this way, that way, this way, that way. You already know, you've picked it.
Yeah.
And then, you know, that's when you take that step to say, you know what? Because I'm not too sure what is happening, you know, let me go and check it out. So there isn't really a time to say, I'm going to wait to get sick before I go.
Right.
That's why we do health checks.
Right.
You don't wait to go and do your normal
Annual
yearly
screening
annual
checks.
screenings,
Yeah.
right? It's preventative.
Yes.
So you're proactively saying, if there is a problem, let me identify it early on and deal with it. And so a mental health check is exactly that. It's a mental, brain, psychological
Health check.
Yeah, the same way that you do it with your body.
So
you know.
conclusion from that, I think we need to normalize that. Hashtag mental health check. Like just go in and just check where you're at with things. I have an interesting question for you.
Oh my God. Okay.
Because we get this a lot on like the doctoral side. Like sometimes the patient would call me and I'll tell them, yeah, I'm not in, I'm on sick leave. And they're like, doctors get sick. And it's like, yeah, okay, if a doctor gets sick, who do they go see? I'm like, another doctor. So my question is like, as a psychologist that's listening to everybody, right? Because you're a human being too and a mom too, right? And I'm sure you probably have parental burnout.
Oh, yeah.
Who do you go and see? Because I'm imagining.
Did you see? I actually almost said something.
What did you say?
No, I'm not gonna say it.
Say it.
I caught
It's
myself.
a safe space.
I really
It's a safe
caught.
This is a safe space.
I caught
You
myself.
can talk to me about anything. I'm sure you use this phrase a lot.
My
It's
psychologist.
a safe space. We listen.
And don't
and
you
we
like
don't
the way you
ever
turn? You're like,
judge.
okay,
Yeah.
let's do this. You know, this is.
Aone, it's
can do
okay.
this. Yeah.
It's fine.
Do you need a tissue?
What were you gonna say?
I'm kidding.
It's okay. Say it.
No, we're gonna leave that out.
I tried.
It's PG.
You saw me.
It's
I
PG.
tried.
It's PG.
Oh yeah, forget it. Forget I asked. But and I'm going somewhere with this, and I'm just gonna touch into it before I get there, so you can structure your answer properly. Because when people ask me that question, I'll be like, yeah, I mean, 75 to 95% of the time, I might know what's going on.
Mm-hmm.
Like, if my tummy's off,
Mm-hmm.
I kind of have the insight of how to deal with it, right?
Mm-hmm.
So my question is two-parted. A, who does the psychologist go see? B, do you ever self-treat as a psychologist? I'm putting you on the spot.
Yeah, you are,
Mm.
hey? And I better think this through quite carefully.
It's a safe space.
But like you said, a sick doctor goes and sees a sick doctor. Goes and sees another doctor, right?
Right.
And a psychologist goes and consults with another psychologist.
Okay.
And I think that's the beauty of medical practice. I'm going to say medical practice in general because we really work in teams and
Yeah.
we consult, right? So you've got a case that you need to consult with, right? Or consult on. I get a case that I also need to consult on. So it's the same principle. I've been going through whatever I've been going through, and naturally, I guess naturally because we do it often within the field, to actually go and actually just debrief, and we call it a debrief, as psychologists with another psychologist to just really let out all of that
Right.
because it is a lot, and I think just our practice in general medicine, for example, if you're a surgeon, you're opening up people, all the time, and that at some point, as interesting as it is, can get to you, especially when you start to lose a patient because
Yep.
it's inevitable. There will be those patients that you will do your very best.
Yeah.
And unfortunately, you lose them. And it's the same with psychology. There are those clients that you will see and do your best, but unfortunately, they just slip between the cracks and they just cross over to the other side, And so it is important that when you audit your cases and your caseload, you keep at the back of your mind that you're actually a vessel. And at some point, you're going to get full, and you're going to start to spill over. And when you don't want to wait till you start spilling over, and that's where you now sit and consult, and say, look, I need to debrief. I've been dealing with these cases, the gravity of the cases, the heaviness of the cases,
Right.
and you just talk to somebody and let it out, and just sort of, empty that bucket.
Did you ever talk to yourself?
Oh, yeah. I just don't answer.
Right. Fair. I have, because I'm team practical. Said something in the previous episode. Once again,
Oh
my
my
pastor,
God.
I love you. I
I-
appreciate you.
I
But
am- I
no,
don't
no,
know
no.
if I should get up.
It's not anything necessarily bad. Just a practical question. And I'm gonna ask this on behalf of the men, right? Who I'm sure aren't frequent visitors. I'm assuming statistically from what I know,
Yeah.
women would visit more than men, right? We're losing
100%.
more men to mental health than women.
Yeah.
My question, because from my understanding, and I stand to be corrected, right? With the way men and women are set up, right? Women tend to be more emotional and expressive. Again, you have societal influences. Men don't cry, this, and that, which is bad, but men tend to be more practical creatures, right? I'll give you a scenario. If the light bulb goes out, and this is a very mundane example,
Call
right?
911. I'm kidding.
And I'm speaking from a point of experience. Before I went and checked in with the psychologist as well, I'm like, okay, but the light bulb is out. And I'm saying this, it might sound silly, but it's a lot of gentlemen that think the same way, right? The light bulb is out. Even if I talk to Aone about it for hours and hours and hours, the light bulb is out.
Still gonna be
I
out.
could just go change the light bulb. So very practical and solution-driven gender, right?
Fixes.
So my question is, does it help? I can speak for myself and say it does, right? Again, as a man and as a doctor. But from your standpoint, does it help going to see the psychologist?
I love the fact that you made that comment to say women are emotional and men are not.
Oh, yeah, I stand to be corrected. Men are more. Have you seen
They're
them?
more
Have you seen a
emotional.
man, even health-wise? Have you seen a man with flu? Huh?
Men are the most in fact, men are
True.
more emotional than women,
Yeah.
but less expressive.
Expressive.
You know.
Thanks for that correction. She's right, by the way. She's a psychologist.
No, but you know,
Yeah, no, it's true.
and I love that you said it the
Mm.
way that you said it, because I think it now helps everybody, even our listeners, to focus
Yeah.
on that very aspect. To
Men are
say,
more emotional.
and in fact,
they
not only being emotional, they don't know how to manage their emotions.
How to navigate that path.
They don't, because
Yeah.
they've never learned. Well, let me not say they've never learned. They've never been allowed to express it
Given the platform.
enough times to be able to navigate the path.
Hmm.
So the reason why we say women are emotional, oh, definitely we're very expressive, but it's because we cry and then we move on, because we know
talk about it with the
we know how to
bros.
navigate that path. You know what I mean? And so because they have not been given that platform enough times to be able to navigate the path, your answer is it does help. Because what do? We actually give them the skills to allow them to be more expressive without losing their manliness, for lack of a better term.
Yeah.
You know what I mean? Because there's also this myth of if a man cries or if a
You
man...
need to stop that thing.
You know what I mean?
Stop it.
Yeah.
You that's watching in your muscle
Yeah.
top just coming from the gym.
Yeah.
Stop. Cry. You know that you weren't able to lift the way you're supposed to lift. And it's here. You're feeling it in your chest. Just let it out. Feel
You
it.
know?
Cry. Come talk to Aone.
Yeah, come to me. You know?
I love how you answer that question to say, again, I'm like team practical, right? And honestly speaking, I'm sure a lot of men can attest to this. You just don't know how to. It's like if you were to drop me in the Amazon right now and say, go back home, where do I even begin?
And even the skills. Do you even have the skills?
To
Remember,
survive.
nobody was born with a how to live life, how to navigate life. Nobody was.
I love how practical you're making this. Because I'm imagining this like the picture you're painting, right? Men and women are born, right? You all come into the world not knowing how to navigate this. But then fast forward 20 years later, women somehow know how to navigate and express, men don't. Where's the disconnect?
Because
And
they
then-
were given the platform from a young age.
And you're saying we're offering you this platform
Yeah.
with...
Yeah. Yeah. Because think about it. Look at sons and daughters.
Where were you all this time? Because I was like, I should have gone seen the psychologist ages
Yeah,
ago, but I never
yeah.
thought about it the way that you've put it.
And we
It's
do it so
beautiful.
unconsciously.
Yeah.
When a girl child cries,
It's okay.
that platform is already being created for them. It's already being created. And so as they grow, that platform is already there. But flip it on, to the boy child, that platform is never created. In fact, a different type of platform is created. So what we end up seeing as psychologists is we need, I talked about skills earlier, that we need to help them or build capability and capacity, from a skills perspective. But what ends up happening, or what we need to do, is we need to help them first unlearn those untruths,
Yeah.
and learn, not even relearn, but learn the truth about human nature. Remember, we all have the same organs. We both bleed, men and women.
Same
we
color,
have the
red.
the brain, we all have it. So why should it be any different from a man to a woman? Except the fact that you have testosterone and I have estrogen. You know what I mean? But other than that, really, the bottom line is we hurt. We're human beings. Human beings hurt. You know what I mean? Human beings go through the most, be it a man or a woman. And all human beings were not given a how to live life guide. But unfortunately, the society that we live in creates different platforms and standards, of how we uphold or define what masculinity needs to look like and what femininity needs to look like. But at the end of the day, we're all human, and pain is pain.
Pain is
irrespective.
pain.
Yeah, pain is pain. Stress is stress.
And the way society is set up, it's just, on a surface level, it seems much, or from a man's perspective, it seems harder to be a man but from a medical standpoint, it's almost harder being a woman, right? I mean, in this way, the standards are set so high for men, almost to an impossible degree, that when you're unable to achieve them, navigating it becomes. I think you've summarized everything. That's why now we revert to the things that we do, the alcoholism, the drugs, and such a touchy topic with the gender-based violence, which there's been some occasions where it's on the reverse side.
Yeah.
But majority, it's the men that are inflicting this onto the women.
Violence is different, remember.
Ooh,
Remember,
verbal,
there's
physical,
verbal, there's emotional,
financial.
there's financial. Aha.
Yeah, I guess it's a
So
rabbit hole.
it's a rabbit hole, and we use different tactics. Women will use different tactics to men.
Yeah.
You know what I mean? But at the end of the day, and you're right, actually, I 100%, oh my God, I 100% agree with you when you say that there's so much pressure. And I really believe that. I think there's so much pressure placed on men.
Right.
And now think about it this way, actually, if I were to summarize it. So men, I almost said stumbled into this world, but men come into this world, right? Unfortunately for them, they're not given the platform to allow them to express.
Right.
You know, I'm stressed, I'm you know, whatever it is. So that's already one down for them, right? And then there are all these expectations that as a guy, as a man, you're expected to do A, B, C, D, right? And so it's a lot. And so you're going through stress. We talked about earlier. We're going through burnout because you're trying to achieve all these numerous and multiple expectations on top of just trying to navigate life.
Right.
You know, outside of even just the expectations. Mind you, remember, you didn't have that platform that helped you, that would necessarily help you navigate, right?
Yeah.
And so here you are, you're trying to, just get by with the stress and the burnout. And then you find yourself with so much pressure, but you don't have an outlet.
Yeah.
Why? Because men are not expected to be expressive. So imagine now finding yourself in that kind of situation as a human being. You know what I mean? Where
Yeah.
does that leave you?
Right.
So I'm really trying to circle back to the conversation that we had earlier to say, when do we do mental health checks? Do we need to wait to feel really off to go see a psychologist? You know what I mean? And is it okay to go and talk to a psychologist?
Yeah.
And like I said, I'm circling back. The answer is for men, even more so than women, you know, because that's where they're going to get that platform that all these years they've been navigating without necessarily the right support. You know what I mean? So, yeah.
Can you just repeat that one more time into the camera for my fellow brothers? So, right there. Right there.
What did I say again?
Men more than women.
I just wanted to make sure that I say exactly what you want me to say. But yeah, like I was saying, men more than women actually do need the services because they really need the support. I think men out and women, we talk, guys. Women, we talk. So you don't necessarily even have to go to a psychologist. You know what I mean? You somehow will find that outlet. You somehow will find a place, to let it out. But a guy will just keep at it.
You know what it is? So, to dumb it down, for a living, you kind of get into people's minds in a simplified way, right? I want us to get into your mind, all right? Let's get into the mind of the mind reader. I'm just going to ask you a few questions, try to get Aone. Let's get to know her a little bit more, right? So I have a few questions that I'm just going to ask you.
Okay.
It's nothing too crazy, I hope. But yeah, nah, fingers crossed. Okay. Let's start here. Would you rather travel to the past or to the future?
Oh my goodness. Can we do both?
No.
We can.
Would you rather travel to the past and why? Actually, I'm gonna throw that in.
I would actually rather do both. I'm telling you. Okay, let me tell you why.
Okay.
It's probably gonna sound crazy, but no, honestly, like I would rather do both because there's some beautiful, beautiful memories from the past.
Okay.
And crazy memories. I always, I once told my kids, and I digress a little bit. I once told my kids that I did something really crazy when I was going through med school that you thought was actually easy. But anyway,
To each his own.
yeah, clearly. And I ended up in a Mexican jail. Don't ask me what happened. Don't ask me what happened either. Okay?
I don't even want to ask the rest of the questions.
No, no,
How
no,
did-
no, 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 no.
You was in jail in
Don't
Mexico.
ask, don't ask, don't ask, don't ask. But as weird as that sounds, listen to this. I would actually go back to that memory. Because actually, I would actually go to that day because that has got to be the most
Emang baby.
funnest
Emang
day
baby. No,
I've
time out.
ever.
Time out. Time out. Aone.
But yeah. The question was, would I rather go to the past or the future?
Oh, you
And that's
answered that already. We're not about to. I don't know anyone
my friend.
that would. Yeah, I'm trying to understand this. 'Cause I'm trying to. You see me out saying follow the trail. What's happening before we end up in a Mexican jail? Like, how do you end up there?
Like I said, don't ask. Don't ask. Just know, right? So yeah, that's
Jeez.
that's my reason of wanting to
Supper
go
well.
to the past, right? But I did learn a lot from that experience,
Of course.
which I carried into my future, right?
Mexican jail.
So I don't drink tequila.
I don't know if I'm gonna sleep tonight. I'm gonna be thinking about this.
But there were some lessons learned from
Of course,
that,
of course.
and I'm actually really glad that I did go through that.
Mm.
First of all, it taught me that I do not speak Spanish under no circumstance, and I should never try to speak Spanish because I think that got me into more trouble.
Hablo español. I think
Nah.
probably butchered it.
But but definitely learned a lot from that one day that I carried into my future, and I'm actually glad that I did have that experience.
I am so sorry.
Yeah, curiosity, right?
How long was you in jail for? A
Just
couple
a
of hours.
Hours,
Okay.
yeah.
So
Yeah.
did they put you in cuffs? Did you
I'm
get
not
like?
gonna say anything.
Did you get like a uniform?
I'm gonna plead the fifth.
Okay.
I'm gonna
Okay.
plead the fifth.
Okay.
Yeah.
And I'm presuming the future on the basis of hopefully creating more memories.
Oh yeah, but also lessons learned. Lessons learned. So, and I think maybe in a nutshell, I'm just really trying to connect this to a mental health sort of conversation as well, to say some of the trouble that we end up finding ourselves in and causing us a lot of stress, a lot of distress, a lot of burnout is we don't learn as well. As we navigate this thing called life, it's trial and error, and hopefully you do learn from some of those lessons so that you actually prevent, the worst case scenario happening. And I'm talking from the context of mental health.
Right.
If I know that I'm a procrastinator, as an example, right, and I keep putting things off, and all the time I miss deadlines, I'm stressed, I'm burnt out, I'm working, I'm burning the midnight oil. You'd hope that from your past you've learned that and you carry it into your future to plan better, so that you actually prevent you going into a distress. Not only stress, but a distress situation, right? And you can see I'm actually digressing from your question of.
No, you're probably
personal.
leading into a couple other questions I have for you.
But I don't know if you're done with your other questions that you
No,
wanted to ask from a personal level.
I got enough.
Oh, you're thinking, is it safe to actually ask any more
Nah,
questions?
it's pretty safe. I think my next one is.
Because I was gonna say, you said that this is a safe space.
It is
So
very safe.
just making sure.
What's because you've spoken about lessons, right? What is an unexpected life lesson that you learned?
From Mexico?
Just in general. Clearly, there's a lot that happened in your life.
I just wanted to be sure whether it was from Mexico.
No, just in general. What's something that you never thought, and it just kind of you learned from it? It's hard to beat Mexican jail, but
Yeah.
go for it.
I don't know, hey. And an unexpected life lesson. Wow. I think that just happens all the time. Well, not all the time, but I think as we go through life, You have those moments. And maybe unexpected life lesson, maybe more of a moment that matters. When you have these encounters, there is that moment that matter. Either because you take something from it or you experience something from it. But at the end of the day, it's a moment that remains ingrained.
Is there one that's like right at the top in its own league for you?
For me,
Yeah.
yeah, don't bungee jump.
You know what? Yeah, I miss Michael because I could almost predict what's gonna come out of his mouth. You? Okay, so
No, but on a serious note,
what happened when you went bungee jumping?
no, we'll take that off camera. No, that one I'll tell you the story, but off camera and without the camera crew.
You know what?
True.
When I had like a brief look at the questions to ask you, I was like, okay, wisdom is gonna be shared.
This is wisdom.
I agree with you.
Don't
I didn't
bungee
think there
jump.
was gonna be a lot of You know what? I'm gonna go back in time. I'm gonna go back in time to the question about the past or the future. If you didn't get it, sorry. It wasn't the best joke. Drier than the Sahara Desert, but
Oh
don't.
my goodness.
Would you want to know how much time you have left to live, since we're on the topic of time?
I think my answers are always, you ask me
It depends.
about.
Both.
Yeah, I would and I wouldn't. No, let me tell you why. I think I'm probably, and I don't know, maybe there are people out there who are not scared of death, but I swear to you, I am petrified of death. Like, I swear, if I could see death coming my way, let's say, for example, death is in Francistown, I swear, my friend, I would be in Joburg because I don't want that thing to catch up with me. I am so scared of death. So knowing that I'm going to die on such and such a date, I swear, that's going to kill me before the day comes.
Wouldn't it be a good thing that you knew?
It's going to kill me before the day comes because I'd be so scared.
Okay, I'm gonna spin it around. Imagine, because you just said
These
if it's in
questions, I swear,
Francistown.
he's setting me up.
The mind reader is going to feel how it feels to be on the other side.
But you didn't even allow me. Okay.
I'm sorry. If you're saying if death was in Francistown, I'd be in Joburg, right?
Running away from it.
I hear you.
Yeah.
So if you knew where it was in terms of location and or time, like let's say God forbid is 2075.
What question is this?
Right? You
It's
know
even gotten
where
me
it
anxious.
is.
Like, let's bring out the blood pressure.
It's I know a psychologist.
Yeah, and you're the doctor.
I know a psychologist.
Bring no,
Get the
I
BP
need
machine. I
the
know a
BP
psychologist.
machine.
We can go see somebody about it.
Phew.
Get up. You know what we could do? After this, we could go do a mental health check.
Go on, Abby.
See what I did. Would you not want to know so that you could kind of see it coming, right?
Oh my God, I don't want to see it coming.
So you'd rather not know and just get caught by surprise.
Well, I'd be dead, so I wouldn't be surprised.
You have a very interesting mind. I'm enjoying this, by the way.
Oh, really? Okay.
Yeah, just seeing your mind spin.
Yeah, but I would be dead, so I wouldn't be surprised. But I was gonna say, wait, let me finish answering that one.
Go ahead.
So yeah, the reason I said I wouldn't want to know is because I'm scared of dying. However, I think there's probably, I don't know, maybe a positivity, I don't know, of not knowing because it allows you, actually there is a positivity of not knowing because you live life to the fullest. Do you know?
Because you don't know if it's going to be your last day.
Because you don't know if it's going to be your last day. That's why I don't bungee jump, because I swear to God, I thought I was going to die that day. So that's the lessons learned. And that's the moment you're asking me about. The unexpected lesson. I didn't know I was going to learn anything from bungee jumping, but boy, did I learn.
Would you like some water?
I'd like the BP machine.
You know, from now on, I'm going to keep it because clearly me having the guests wild up. You know, I was thinking of skipping this one, but I'm waiting to ask.
Oh my God.
Yeah, I'm still going to ask
Ready
because
to
I'm
hide
sure.
behind the camera.
Here's the question. What's a surprising fun fact about you? Reason I was going to skip is we had Mexican jail, but then you brought up bungee jumping. I'm like, okay, there's clearly a lot going here. So what's a emphasis on surprising
Oh my God.
fun fact about you?
Oh my God.
It could be a simple thing like you don't like popcorn. I don't know.
but I do, so I'd be lying.
And lying is bad, ladies and gentlemen.
No, here's a fun fact about me. So I've just gotten this over the last couple of years, motorcycles. Like, I love motorcycles. And so I decided to learn how to ride a motorcycle, a motorbike.
Okay.
You don't seem surprised.
I mean,
you're all out
you,
of.
After Mexican jail, there's nothing else that you're gonna tell me. That's
So here's a fun fact. So I really love motorcycles.
Uh-huh.
And in fact, last year I went and did my birthday photo shoot on a motorcycle. Yeah. I'll show you the picture after this recording. I know, right?
Okay.
And I look really good.
come on.
Yeah.
Love it for you.
So, and I just love the speed. Like, totally. Absolutely.
You see, I'm having a hard time because in med school, we had a lecture on psychology, right? A couple of lectures. I
Med
think
school
we
is
watched.
torture.
It was. We watched Beautiful Mind, I believe.
I forgot that movie, but I remember the name.
Yeah, Beautiful Mind.
It was about some guy, right?
Yeah,
He was kind of crazy.
Yeah.
Maybe I shouldn't use that word, but
Yeah, I don't know
he
if we're
thought
allowed to.
differently.
Yeah.
He thought very differently. He was very colorful in his thinking, right?
Yes,
Yeah.
he thought differently. I think in the movie he had a roommate that he imagined but wasn't actually there.
Kind of what's that guy's name?
I think it's based on a true story as well.
But the guy, the main actor, he's the guy who was. What's the other? Anyway, yeah. I get
What was
the
my
movie.
question?
You were
I'm
talking about A
confused.
Beautiful Mind.
Yeah, no, I'm saying like in school we had psychology class,
Oh,
right?
yeah,
So
that's
I
what you were
could
talking about. Yeah, I remember.
probably try profile somebody, but I'm all over the place with you, ma'am. I can't keep up.
So you are actually saying in an indirect way, guys. Did you hear what he said? That I'm like a Ted Bundy. Because they could never profile him, right?
Those words did not come out of my mouth. If the shoe,
You've been pleading the
Is,
fifth a lot. Or is it the sixth? But you've been pleading the fifth a lot.
I don't know. I'm just saying.
You said those words with Dr. Michael earlier.
I can profile you. Like, I don't think anybody that's watching can. To be fair, I mean, don't judge a book by its cover. Read the book. Yeah, I've been reading, and yeah, I don't know.
And you're just going through the pages.
You spoke about maladaptive behaviors. Yeah, just a glass of wine, maybe two, and then it becomes a bottle. Is there a habit that a habit that you built that you're trying to break?
How is this guy going to be asking me that? Like,
No, because you know what it is, right? I think my main focus is
But
also
yeah, I
just
agree.
trying to make you more human. And like you're a human being too. Like maybe you be having habits that you're trying to break.
I do.
Remember, it's a safe space. There we go.
No, I do. I think one of the biggest and things that I really struggle with, it's actually two habits. I am such a perfectionist. It's not even funny. Like, I will ask for help, but I will redo. So I don't know, and this is where now I start self-diagnosing.
That
And I-
answers my question from
Where I'm
earlier.
like, do I have a bit of OCD? Do
you?
I don't know. Maybe I need to do a bit of differential diagnosis here. But anyway, so yeah, I'm such a perfectionist that things have to be done. So I'll come to you and be like, you know what, I need help with this. Can you help me with 1, 2, 3? And you'll do it, right? And it'll actually be great. But for whatever reason, I need to do it myself. That's the first. And then the other thing is I am such a workaholic. Like, I can get up at 5 in the morning and keep going and be working until 2 a.m., 3 a.m., sleep for 2 hours and be at it again, And I think for me, that is really bad because one, I don't give my body enough. Now I'm being really serious because I've been talking about stress and burnout, And sometimes, it's things like this that actually tip you over the edge.
Right.
Because I'm not giving my body enough time
To rest.
To rest, And then I'm wondering why I've got neck aches and back aches and headaches and
coming to
aches
see
all
what
over.
Nelson.
And coming to see what Nelson, Waban. And you diagnosed me the other day, by
I
the
did.
way.
I
And
did.
and while I'm sitting here talking about that, I remember it just hit me that the reason I was feeling the way that I was feeling was probably because I'd overworked myself.
Yeah. Yeah.
And when you
Yeah.
told me to take vitamin C, I was like,
It's probably the first time it was the first time I met you
yeah.
when you came in for the consult.
Mm,
And then later found out that you were a
mm.
psychologist. So small little world.
Ain't it? But yeah.
You're a hard read, man. Like I but okay, let's do this.
Mm.
Let's just conclude by saying, even though because apparently healthcare professionals be doing the opposite of what they tell people to do. Um, I'm guilty of it at times. Can we agree that being a workaholic and to some degrees the extremism of being a perfectionist are not good things?
Maladaptive. I'll be the first, and that's why it's like this is like a kind of like an AA meeting now for me. Hi, my name is Aone, and I'm a workaholic and a perfectionist, and I need help. And I'm being really serious.
Leading by example. I like that.
Yeah, because I really believe that it can lead to other, physiological illnesses. And I take it for granted because at this point in time, I can keep at it. Keep at it. But just like I was saying earlier, I was in your office and I was literally on the verge of shutting down, and it's because of that. And I think we do it, and because our body somehow finds reserves somewhere. It's like a car. You'll have a reserve tank, and you'll be on empty, and you're still pushing the car until it just says, you know what, I am not moving.
Yeah.
I don't care how much you press
Good
on
night,
that pedal.
shut down.
Good night, bye-bye, adios.
Yeah. Adios. I see what you did there. Miss Mexican jail. Wait, so you're a criminal? I am literally so
And look at
invested
the way
in
he
this chat.
sits down. He's like, yeah, I'm ready to continue with this conversation.
You know what it is?
Who needs who needs enemies with friends like this guy?
I got you. I proper got you. I think in summation of it, because I've learned so much about you in this little sitting.
And
right?
psychology and mental health.
Yes, my favorite criminal. I want you to sum it up. Seeing that it's mental health month awareness, right? If you could give 3 pointers. My thing is I admire the fact that you're, what's that thing? Trying to point out dust in people's eyes when you have a whole desert in yours, right? You're not coming here as, oh, I'm perfect, I'm this and that, so come see me, right? You're human too. You understand what people are going through. I mean, if anything, you're kind of going through the motions and learning yourself. If there were 3 tips that you would give, I mean, I'll take away my takeaway home is, with regards to men, we don't know how to navigate, right? And if more than anybody in gender comparison, you should be the ones coming in to get a mental health check. I'm taking away your points. I'm so sorry. The second one for me would be check in. It doesn't hurt to just go pass by and say, hi, Aone. This is how I'm feeling. I was locked up in Mexico too. Let's talk about it. I'm not going to let it go.
I swear.
But what would be 3 tips that you would give out to the people in conclusion?
Thank you for saying the 2, so I guess maybe I'm just going to say 1 tip. But,
Fair. Sum it up in 1.
No, but I really honestly think that mental health, in my opinion, is probably the most overlooked. And I say overlooked because we say and we talk mental health, but I don't really think we internalize what we mean by mental health. You know what I mean? And I think there is a tendency for most of us, and me sometimes even included, doing it to myself, where we brush things off and say, it's nothing, I'll get over it. Not realizing that is the very thing that's going to push you over the edge. Why? Right. Because when you have a sore on your on your hand, and you see it grow, or you see it canker, or you see it spread, that in itself will get you to the doctor. But unfortunately with mental health, you don't see it, and so you tend to minimize it. And I think that's the mistake that we make. Mental health is not minimal. It really is not minimal.
Yeah.
And I'm not saying this as a cliche. I'm really saying it because we see We hear of incidences, just about a month ago, the incidents actually that happened at CBD.
Yeah.
We all read about them, we all heard about them,
Very unfortunate.
very, very unfortunate. But one stops and wonders and says, and asks themselves, did these people not feel that or didn't have an outlet? Have we become a society that doesn't even allow people this to feel safe enough to actually go and
Express.
talk and express?
Yeah.
You know what I mean? So I think for me, it's little things, little big things like that.
Little big things.
Little big things like that that actually make me stop and say, you know what? Let's just internalize this concept just for a minute to say, if we're still seeing these incidents, what does it say about us as a society?
As a people.
As a people. And as a people that's trying to actually advance and move forward, you know. So let's just stop. I think to everybody listening, I just want you, and I'm gonna actually ask you to do it. Actually, just for 30 seconds, just ask yourself in your lonesome, and do answer yourself. Actually, this time around, what does mental health mean to me? Mean to me, not just as a concept, but me myself. Am I mentally okay? That is the first takeaway. Do it, do it, do it. Second thing is, when you do actually feel that you're off balance, go talk to your GP if nothing else. You don't necessarily have to come. They will help you determine if you really are off balance, And that's the first step.
Yeah.
Because we're trying to demystify it as well.
Absolutely.
You know what I mean? So go to your GP. Go where you feel safe.
Yeah.
That's the second thing. Go where you feel safe.
Absolutely.
And talk about it. But make sure that you actually talk about it with a professional, because that is the person who's actually going to say to you, yes or no. Yes,
Right.
you need help. No, actually, it's just a bad day. Type of scenario. And I think the third thing is just let's learn, and it's such a small thing, but it's such a big thing. Let's just learn to be kind to
Thank you.
ourselves.
Yep.
Let's just extend ourselves grace. If you've done your best at the end of the day, but you didn't finish your to-do list, it's okay.
It's okay to be not okay.
And it's okay to not have finished it. Really, honestly, tomorrow is another day. And we say it, but we don't practice it.
Yeah.
Extend yourself grace. Literally just say, out of the 10 things on my to-do list, I did 2 kilikili. Tomorrow I'll pick up number 3, 4, and maybe if I end up with 5, that's okay. So give yourself a bit of grace and a bit of love. So yeah.
In conclusion,
You've been saying that. That's the third time you've been saying it.
for the fourth time, in conclusion, I just want to say thank you to our lovely clinical criminal psychologist. I ended up in Mexican jail and we'll never know why. But thank you so much for your time and your insights and just allowing us to delve into your mind. And to everybody out there, before being kind and gracious to the world, be gracious to yourself.
100%.
Have yourself a lovely week.
And thank you to everybody.
That was a nice episode.